Hi, everyone. Welcome to the CURES show, where we explore the cutting edge for our body, mind, and spirit. I bet a lot of you have kids who play organized sports, and of course, concussions can be a big part of that, a big concern. So I really wanted to bring you an expert when it comes to detection, prevention, treatment, and more. So here with us now on CURES is Dr. Stephanie Alessi-LaRosa. She is the director of the Hartford Healthcare Sports Neurology program. Thank you for being here.
Thanks for having me.
Full disclosure, I had to go to you once for myself and once for each of my children. So we've become good friends. And what I've learned is if you've seen one concussion, I guess you've seen one concussion.
Correct. Yep, that's the best way to say it. Everyone is so individual that it's really not meant to be cookie cutter sort of protocols and treatment. You know, you really have to individualize the approach, and that's what keeps my job interesting, is actually how different they can be.
And so you're also, there aren't many of you, right? You're the only one with your kind of training in the whole state of Connecticut.
Yes, I am the only fellowship trained sports neurologist in Connecticut. There's just not that many fellowship programs right now in the country. So, but I am happy to say that Hartford Healthcare has the only sports neurology fellowship in New England and in the Northeast.
So we need more of you. And so if people are interested in medicine, it's a great field to go into.
Absolutely. I mean, you think of, you know, orthopedic sports medicine, primary care sports medicine. There's a lot of sports medicine specialists, but not a lot of neurologists. And, you know, it's always amazing to see how important it is to have us there, you know, so it's exciting.
Because you're doing, I mean, this is why I want people to understand, like, you're doing, we might have kids playing soccer, football, different levels, but like literally you're on the side of the ring when people are doing boxing and knockout sports.
Yes, I am a ringside physician, and you know the point of boxing is to neurologically impair your opponent. So it really keeps me busy on those events.
Yeah. Now for the rest of us, maybe you're playing sports on the weekend as yourself, or you're really worried about the kids because there's so much talk about concussion. People are afraid to let their kids play contact sports because of some of the information that's come out about the brains of football players and things like that. Let's start with this. Do we have to worry that when you get a hard hit, it's going to mean a concussion, or not every hit's a concussion?
No, it's true that, you know, you can take hits to your head and they cause symptoms that are similar to concussion, but not necessarily the brain injury where the force is actually imparted to the brain. But it can mimic a concussion because you can still get a traumatic migraine, for example, where you do get a headache and some light sensitivity and nausea, things like that. But it doesn't necessarily mean you have a concussion. So we would be looking for more, you know, any sleep disturbance, mood disturbance, you know, other things that are sort of brought into the picture that we couldn't explain just from a migraine, for example. But yeah, so sometimes these hits, depending on the mechanism, what the forces were involved, it doesn't necessarily mean it's a concussion.
So when you talk about mechanism, this is interesting because when I was at work, I had something fall on my head and I got a big goose egg. And I went to you, and one of the things I remember you saying was, I ended up not having a concussion, but you said it's not usually when you have a goose egg or something just hits you that you get a concussion. It's more when your head bangs flat against something, maybe on an ice rink or a hard field.
Right, and there's so many, you know, scenarios that we could play out, but it really is a combination of what was the mechanism. You know, if something hits you and you didn't move, you know, it's hard to get the injury imparted to the brain, the forces, you know, but if it's like, you know, you're running at the shelf or something, not just standing up into it, right? That's a different kind of mechanism. So really thinking about even these day-to-day injuries that happen, not just sports related, you know, and certainly car accidents and work related injuries and things like that. I mean, you really want to think about them all in terms of the mechanism of the injury and the symptoms that were produced.
So let's define what really is a concussion.
Sure. A concussion, you know, the medical definition is that it's a transient injury where a biomechanical force is imparted to the brain and it triggers a number of neurologic symptoms, but it really is a functional disturbance, not a gross structural injury. So a CAT scan or an MRI would be negative in a concussion. Concussion is the mildest form of a brain injury.
Okay, so it technically is a TBI, a traumatic brain injury. But do most people recover fully from concussions and can continue their normal life?
Absolutely. I mean, there's no structural reason why someone can't improve fully from a concussion. It's really about, you know, a lot of times I find patients who have prolonged recoveries, it's a lot of times due to a mechanical injury to maybe the neck muscles from hitting their head, that their neck is now strained. And then they can have eye tracking things that are off as well. And so those really require more physical therapy or some sort of rehab to help calm those symptoms down and put them away, rather than the brain injury still itself.
Okay, so let's talk about, for a warning sign for parents out there, when do we need to go to the doctor?
Great question. So really when there's a hit to the head and neurologic symptoms is when you want to have this idea of maybe a concussion in your mind. But if the headache starts to like really worsen and becomes like very severe headache, that would be a red flag sign. If the patient starts vomiting, if they start to lose mentation, like they're less responsive or harder to arouse, or they're more fatigued, any changes like that, or if there's just a lot of concern around, maybe it was a huge hit, or just, especially if they lost consciousness, those are things that they should go seek emergency care even.
But sometimes it might be even more minor. Like I remember when I brought my daughter to you from a dance injury, I wouldn't have known to go had I not gone for myself. Where the next day she's like, Mom, I feel really nauseous and have a headache. And I'd never heard her complain of a headache before.
Yes.
And I remembered that she hit her head coming out of a trick wrong in dance. I wouldn't have thought of that, but she ended up having a concussion.
Yes, yeah. I mean, I remember the video even where it was like flip after flip, and then, that momentum going into that injury was a significant mechanism. And then just the symptoms, again, sometimes they don't show up right away. And this is, I give a lot of lectures around the state to different types of providers, emergency medicine, urgent cares, things like that, primary cares. And really my advice to them is that you don't have to call it a concussion in the first couple of hours. It may reveal itself over time. So a lot of times when someone's in a sport, they have a lot of adrenaline running, they just don't feel that headache necessarily. But like later that night or the next morning, it can really reveal itself. So there is that period of time that, it may not be so clear.
Okay, so to be concrete, if you're a parent listening, it's probably, you'll notice something though within 24 to 48 hours?
Yes, I would say so, yes.
Okay.
Yeah, yep.
Okay, so then, if you're worried about it, it's not something we diagnose ourselves. Having seen what you do, it's very, very specialized.
Sure.
So how do you detect a concussion and determine that one has actually happened?
Great question. So, in the office, we do a thorough history and what happened, how did it happen, and what were your symptoms produced immediately and over that first day or two. And then we really ask about sleep and hydration and mood and just all the other things that can come from head injuries. And then we do a thorough neurologic exam. And a lot of that, for me, in terms of concussion, centers around the eye movements, so various eye tracking modalities, balance, and then a full neurologic exam where we check strength and reflexes and sensation and everything else.
But there's not like a scan. I mean, a lot of things you think you're going to go in there, you're going to scan, you're going to say, look, you have a concussion. There's none of that. It's really you observing all these really nuances that I guess tell us the condition of our brain.
Absolutely, and that's the beauty of neurology, and one of the real appealing factors to becoming a neurologist is that our examination tells us so much more almost than a scan can. And neurology is one of those very unique specialties where, it's not just an auscultation here and there. You might still need a chest x-ray for that, but for brain injuries and brain pathologies, you really need to do an exam, and that will guide you to where the lesion is often. So, so the neurologic exam is just amazing in that way.
So I feel super lucky that I was told, okay, call up Dr. Stephanie Alessi-LaRosa's office at the IR Neurologic Institute, is that what
yes.
But at Hartford Healthcare. So I knew to call,
Yes.
and then ever since, it's been where I've gone for different, and now I'm getting to do a story with you. But if you're an average parent out there and you don't know, can they just call and go, or should you go to the ER first, or what's the step? What's the right way to do it?
I mean, it depends on the situation. So a lot of times, again, if it's like an urgent, something's happening to my kid, go to the ER. There's no question that would be the fastest way to get through that initial period. But certainly, reach out to us. We often just take a brief story of what's going on with each patient when they call in, and then I review all of the cases and we determine if they're most appropriate for our office or for another neurologist or for something else, depending on what the problem is.
For kids, should you start with a pediatrician? Can they diagnose concussions, or they should know to refer out if they're not sure?
Yeah, they can, but actually there is a lot of research that getting to a head injury specialist earlier is better.
Okay, and so this isn't something that you have to get referred to. Well, I mean, everyone has different insurance, but in general, I learned I could just skip that step.
Yes.
And now when I've had a concern, I've called and gotten in and got a screening if we needed to know.
There are some insurances, of course, that may require referrals. So my office usually handles that at the outset. But really, call in and then we'll just kind of take it from there.
Yeah, and people will think that, oh, it's going to take me forever to get in, but that's not usually the case.
No, I always save extra spots or urgent spots in my schedule for these kind of, my kid got hurt, can you see them this week? So we do have a way of fitting people in as soon as possible that need it.
How do we, as informed parents, take, I mean, I know so many moms when we're all playing flag football and then it gets to the tackle football and they're like, no, I'm not letting my kid play. He's probably not going to the NFL. Have you seen what's happened to all those brains, all these stories about CTE? Can you help us understand if those are warranted fears or actually we're getting a little too much hype and kids should play?
Yeah, that's a great question. I get that often. You know, flag football is great, especially in the earlier, the younger ages. It really does give the players a chance to learn the sport, and understand it better, get some good conditioning and some skills around it without the tackling. I do think that, any tackling under the age of 14, I kind of discourage. I just think it's not necessary. And, the brain is still developing even through high school, but there is a level of, athletic trainers are more available at the high school level, and, having that extra layer of support medically for their competitions is really what keeps the sport more safe.
Okay. And I know that for us, actually, we did allow our son to play football, and yes, he did get a concussion in high school, and we ended up in your office, which is one of the reasons I wanted to bring this. But he's better now, and do we need to worry that, okay, you better stop now because you've had a concussion?
No, not necessarily. That's a real case-by-case discussion, and especially at the high school level and even collegiate level, it really is more benefits than risks to playing sports. It's just such a great thing for the developing brain and for social reasons, for leadership skills, for all of the benefits that we talk about for kids participating in contact sports. So I try not to deter that. Certainly there's case-by-case situations, but I can tell you it's so rare that I have to really shut somebody down and say, no, I'm going to discourage you from continuing. It is so rare. I can probably count on one hand how many times I've had to really do that at the high school level. That's such a rare thing. When we talk about professionals and I see athletes who were professional and retired from professional sports, and we handle those situations as well. But again, very different scenario than this, than like your son.
Okay. And for all the kids playing out there, they'll say football gets a bad rap because of all the things that we hear or see.
Yes.
But from where you sit as a neurologist, is there one sport that you would say I really don't want you playing, or you're kind of okay with all of them? And
no, I think, again, it depends on the level of competition and what their goals are and things and what their history is. If somebody has, let's say a kid has a history of epilepsy, and maybe, so there's certain sports that we might counsel them about doing instead of other sports. So it really does depend on the situation. But by and large, the general population, healthy kids, I would say try what speaks to you, and what your interests are, and we can always handle whatever comes of that.
So is there a certain number of concussions that you're like, whoa, we're done? Or it's not about the number, it's about recovering fully?
Absolutely. It's not about the number. Whether there's 3 or 5 or 8 or 10 or 15, I don't know, maybe we can't even count. Maybe we can't count anymore. There's been so many that I have patients like that, who again play at the higher levels. And it really is important to know that they have recovered fully in between each one, back to their baseline, and they're not starting to have more symptoms like, oh, I started having migraines after my second one, and now I have, some depression or something. When I start to hear things like that means something different. But if they've recovered in between each one and within a reasonable time frame, and their exam looks good, again, the history exam, then it's actually can be okay.
I mean, the scary stories we hear are sometimes where, oh, yeah, my so-and-so got a concussion and it took him, he wasn't right for like 6 months. He couldn't go to school right, or his mood was bad. Is that because they didn't get right treatment, or what about those stories that scare people?
Yeah, it's hard to say. I mean, I certainly have had cases where even, under my care that they can be prolonged, Okay. So it's not always about the care they received, but a lot of it can be. There are factors that occur from the injury. like a neck strain, or we call things occipital neuralgia, where there's, you know, nerve injury just to the back of the head, not in the brain, but the back of the head, that can continue to cause headaches. And if they're not addressed, then that would be a reason why it would prolong. So as much as we try in my program to identify all of these other sort of sneaky things that should be addressed and can improve their outcome, even with that, sometimes people do go on to have prolonged recoveries.
Okay, so let's talk about treatment. What really works? I know, at least with both of my kids, the first thing that happened was we took some anti-inflammatories.
Yes. Yeah, a lot of times that helps to just calm down the intractable headache and calm down any neck muscle strain that might happen. So a short course of something like an anti-inflammatory is totally reasonable. But, you know, after that, again, it's sort of case by case. You know, do they have neck strain? Do they have, you know, muscle spasm? You know, are they having a sleep problem? Are they having, you know, lightheadedness when they get up? If they're lightheaded, maybe they have some autonomic component that is requiring more hydration, or, you know, the list can go on and on, of course, but really then that's where we kind of get into the more comprehensive and individualized approach.
Okay, so at least in our case, and I know it may be different for everyone, go to Dr. Alessi, but like it was, you like them to do Aleve more than like other medicines, I guess, Aleve.
Yeah, that has naproxen in it, so it's a little bit different than ibuprofen, and you only have to dose it twice a day, whereas some of the, you know, ibuprofen and things like that are more frequent through the day, so a little more onerous of a regimen. And it works a little bit better. There's a lot of research about that.
Okay, then hydration. I know this sounds simple, but like one of the things which my son did not mind, but you were really encouraged. He needed a big bottle of Gatorade in the morning and in the afternoon. So hydration is really key for treatment?
It is. It can be. You know, a lot of athletes think they're hydrated because they're drinking a gallon of water. But after a concussion, they might feel, no, I'm drinking my gallon of water, but when I stand up, I feel lightheaded, like I need a minute. And that's just not normal for them. So in that scenario, continue the water being at that level of at least 64 ounces, but adding in some electrolytes such as Gatorade that has sugar and sodium, both of them really can help just your body take in more of the water rather than pee it all out.
Yeah. Well, and what I learned also is I thought, okay, I'm going to do the healthy one, you know, like I have some noon tablets that adults are taking because they don't have sugar in them and they're a little bit more pure. And I thought, well, that's better, right? And you said, no, actually, the Gatorade or something like that was better with the sugar. Don't get the zero because your body needs the sugar and the sodium.
Correct. So actually the way Gatorade works is that there's certain transporters in our gut that it requires the presence of sugar and sodium to use those transporters. And then once the sugar and sodium cross over into your body, the water just follows. So then you're really absorbing so much more. But if you only do like a sodium tablet or add salt to your diet and not the sugar as much in the hydration, then you're still getting some benefit, but it's maybe not as much as we would find with the glucose and sodium.
Okay, so really important to hydrate if you're feeling that lightheadedness, and it's hard with kids because you're not with them all the time and you have to push it, and they think they're drinking, but they may not be. Okay, there's also, if people are looking online, or maybe they also have a functional or naturopathic doctor in their world, we have a lot of them on this show, a lot of talk about protecting the brain and taking a lot of fish oil, especially after concussion. The advice I got was definitely ramp up his omega-3s. What's your take on some of that supplemental stuff?
Yeah, supplements, you know, can be great. You know, they do serve a purpose. I think I don't have a set, you know, again, protocol of vitamins or supplements for folks to take necessarily, but as long as any ideas out there people have that they ask me about, similar to the omegas or fish oil, if it's not potentially harmful, I'm okay with it because it's, you know, potentially helpful. There's some anecdotal, you know, research and research out there that it could be helpful, but there's not enough evidence for me to recommend it. So, so it's sort of in that realm, but I'm not opposed to things like that as long as they're not potentially harmful.
Any special diets or things you need to do in your lifestyle if you're recovering from a concussion?
Yeah, the biggest thing about diet or meals is that the brain likes a routine. So, you know, sleep, being on a schedule, eating at morning, noon, and night meal times, I find that to be much more important than necessarily what people are eating during concussion recovery.
As long as it's not Twinkies every meal.
Yeah, that's true too. Yes, there is
Saying that
some
for
of
the kids, okay?
Yes, that is some of that. I'm not saying do that, but having a schedule, not skipping meals, long periods of fasting, and a lot of people do intermittent fasting. You know, you want to just while you're recovering from a concussion to maybe just get back on some sort of schedule with a morning, noon, and night routine.
Okay. Okay. So even if you're an adult, I hope kids are probably not doing intermittent fasting.
No, but you know.
But if they are, but anyway, or sometimes college athletes are really just amping up protein and not having carbs.
Right.
Is that not a good thing? Does the brain want those carbs? Or
yeah, I mean, it's just you want to be as balanced as possible, not doing too much extremes really during that period of time. Yeah.
What's something else? Let's say it's your family member that you tell them that maybe not everyone's aware of with concussions.
And that's funny. Well, my family's tough because I have a father that's a neurologist and a sister that's a neurologist. So maybe I can't talk to my own family.
Nieces or nephews or or people here listening. Like the things you wish people would know. We've got the hydration. I thought that was really interesting.
No, that is huge. I think because people always underestimate that. And it's funny because the feedback I then get at the next visit from folks is Gatorade changed my life. You know, hydration changed my life, you know, and that's what you want because it's not a medication, you know. I don't want to get into side effects with folks on medications if we don't need to. And it's really important. So hydration I think is huge. Sleep is important to talk about too because folks get into like napping a lot and forcing themselves to nap. And I really discourage that after the first 2 days.
Because of the fatigue.
Because then it sort of perpetuates the fatigue because you're just not getting good quality sleep at the nap and not good quality sleep at night. So then it's sort of like you need the naps, but you're still daytime fatigue all the time. So you want to tighten it up and get your sleep back on a regular schedule at night.
And keeping in mind that fatigue is a symptom. If you've had a hit to the head and you have a lot of fatigue and you're not feeling great, that could be a symptom of a concussion.
Yes.
Okay. So these are number one for detection. Early matters, but it might not happen right after. If there's someone on the field that says no, he's okay, it might actually be a day or two later.
Yeah, the symptoms may not reveal themselves right away. But what we really encourage with, you know, kids playing sports, that if they take a big hit or they take a hit and they're not sure, you know, the coach, the parents, the kid themselves, you know, we really want them to be advocating for themselves even and saying, I took a big hit, I don't feel like 100%, I don't know exactly what's going on, I don't feel like I feel something, then they can remove themselves for the rest of that game because you don't want to be in a situation where maybe they are concussed and they continue to play. And that's something that I do a ton of counseling on with especially high school athletes because, you know, every game is so important to them. And but really by playing on with a concussion and not reporting it, you know, if they take another big hit, then we can get into some more severe and prolonged outcomes and things that we don't want to be dealing with.
So that's really the danger is it's not, you're saying numbers of concussions. You treat people who are totally fine, who might have had a lot of concussions, but it's making sure they recover from each one. But if you get a second hit when you're concussed, that could be a big complication?
Absolutely. You know, there's a very feared complication called second impact syndrome. It's super rare. I have not seen it, but you know, you just don't want to have that case happen. And that's where the brain can start to really swell rapidly and, you know, can cause coma, death, you know, really catastrophic things. So so that's the real reason, even if having one case of that is too many, you know. So you really just need to recognize it, remove them, and as much as possible, just get them back as soon as possible safely,
Now, I know you see kids and adults. Does it matter if you're younger to usually bounce back quicker and a concussion is less problematic, or it's worse because it's developing brain?
Great question. There is a lot of research that says that kids actually have prolonged recoveries.
Okay.
So so they can have, you know, just it takes them longer to kind of come around. We don't know exactly why that is, but that is something that we see. So we kind of go a little slower with those folks. I think a lot of times we just want to make sure, you know, be extra sure that we're not returning them too soon as well. But, you know, you really just want to go symptom-based. So every day the injury can change, the symptoms will change, and so we just kind of have to keep a close eye on that and follow them closely.
Okay, and we're going to come to the close of this, but I also want to talk about something you mentioned, but we didn't really get into it. Depression, anxiety, moods. We're learning this with long COVID. Those can be symptoms of a concussion because I guess your brain is swollen, and sometimes it could lead to not just pain, but mood disturbances.
Absolutely. You know, whether folks have a history of anxiety, depression, and it's well controlled, let's say before the injury, then they take a hit and it sort of exacerbates it, and it can really exacerbate a pre-existing mood. But it can also be a precipitant for anxiety, depression as a new onset from the injury. Irritability is probably the most common mood thing that we find with concussion. So if their mood is a little more irritable than they usually are, that's another feature. But you can have anxiety, depression, even some PTSD depending on the circumstance of the trauma. And so, those are really important to address early on, get folks into some psychology and get some strategies and tools for that, yeah.
So you wouldn't treat that part. You would send them to a mental health. I didn't know, do they go on an SSRI for a concussion, or they more just learn therapy?
Yeah, I always start with the psychology first, again, because especially in somebody who did not have a history of anxiety, depression before, then they really shouldn't require that long term. But during the concussion and the injury, it would be great for them to have some coping strategies. So from a psychologist or a licensed social worker, things like that, to get those strategies, yeah.
Okay. Any difference between men and women or boys and girls?
Great question. So it's interesting because women have more of a propensity to have migraines. So there's a lot of that, they're coming into their injury maybe with a history of migraine, and that can prolong their recovery. So so those are some of the differences. Some estrogen component, people, there's some research about that as a hypothesis as well. But so it's hard to say. A lot of it can be behavioral, how much are men versus women reporting the injury, and symptoms, and so there's a lot of studies. It's so interesting on the behavioral aspect, as well as the treatment course itself.
We do talk about that here too, because women tend to kind of, even with heart disease, they're like, I'm fine.
Yes.
I'm fine. Let me Google the symptoms. Actually, I'll call the doctor later because I'm busy.
Yes, it can be all over the place.
So just to review in our final minute, if you're going to, you really want to get detection, it's better to get it ruled out. I've had it happen both ways, where mine was ruled out, and when I thought my daughter didn't have it, she did.
Yes.
So we want to get an expert, because it's not something you can really detect on your own. When it comes to treatment, a lot of times there's really good things you can be doing, and the hydration, super important, and following whatever prescription. And a lot of times that might mean physical therapy, whatever the doctor is saying. I know you've done some eye tracking. There's different things, but on average, if you do all those things, on average, you could be really fully recovered in about 2 weeks.
Yeah. Weeks. Yep.
In weeks,
Yep.
Not months, but
Correct.
But months could happen, and then you need someone like you to really figure it out.
Yes.
Okay, so there you have it. Now you've spoken to the concussion guru in Connecticut.
Yes, thank you. Yes.
Your phone is ringing now. Okay, no, I hope everyone's learned so much, and thank you, because I think it's misunderstood, and then people just get really afraid, and they just say, okay, we can't do anything, and that's really not the case.
Right. And you don't want to go too far on, again, either extreme. It's important to play sports.
Case by case. All right, Dr. Stephanie Alessi-LaRosa from Hartford Healthcare, we really appreciate your time today.
Thank you so much.
Thank you. Thanks everyone for watching, and you can follow me on social media at Kara Sundland for more information. Have a great day and be well.